So Venetoclax is a drug that's not yet approved by the FDA for treatment of CLL. There's more and more data that we're hearing about. There's quite a bit of data, I think, that's being reported here at ASH 2015. I know, Dr. Ma, you've had a lot of experience, and you have an abstract that you're updating at this meeting. I wonder if you could comment first on the mechanism of action of Venetoclax, and then perhaps give us a summary of your updated data that you're presenting here.
Right, yeah. So Venetoclax is a BCL2 inhibitor because BCL2 is an important anti-apoptotic protein that's overexpressed in many cancer cells that allow the cancer cells to survive. So by blocking the BCL2, you can induce the apoptosis initiation. And Venetoclax is an orally available selective BCL2 inhibitor that has been studied, previously reported in the relapse refractory CLL patients that has a very high response rate. In this ASH meeting 2015, there are two interesting studies. One is Venetoclax single agent in 17p deletion CLL patients. That's a relapse refractory group. So in this phase 2 study, the overall response rate is reported to be 80%, and the complete response rate was 10%. The 12-month progression-free survival was 72%. So you can see that monotherapy with Venetoclax can induce a deep and durable response. And then I'm going to report an updated analysis on our phase 1b study in combination of Venetoclax with rituximab. So this is also in the group of patients with relapse and refractory CLL. In this group of patients, we have noticed an overall response rate of 86% with a complete response of 47%. And more importantly, 55% of all patients achieve an MRD negative bone marrow response, so very deep response. And we have also looked at the progression-free survival and overall survival. So at a 24-month analysis, so about 86% of patients are free from progression of disease. Another interesting phenomenon is that when you look at the duration of response based on MRD analysis, none of the MRD negative patients actually have progressed at an 18-month mark, whereas MRD positive patients, about 75% of the patients are free from progression. So this is regardless of the quality of response. If you have an MRD negative PR, you can also actually be free from progression at 18-month analysis. In this study, another interesting thing is for oral agents, as we have talked about with the BCR inhibitors, is advised for patients to continue on having continuous treatment. But with a very deep response we're achieving with the Venetoclax therapy, we're asking the question, can patient actually stop treatment and still maintain the response? So far we had 11 patients who have stopped Venetoclax therapy after achieving either a CR or MRD negative PR. And only 2 of those patients have progressed after 24 months after off therapy. And both of those patients were MRD positive patients. So I think the bottom line is that achieving an MRD negative, very deep response does seem to allow the patient the chance to possibly get out of the treatment and still remain in remission.
I think it's very important. I mean, some of those patients were our patients, and I think that the idea that if you can stop a drug and have the patient do well after stopping the drug is actually very exciting for many patients. Having a limited, finite course of treatment, it may be possible if you obtain a deep remission. We had discussions with patients, and obviously some who had achieved either an MRD negative CR or just a deep CR wish to consider going off treatment and following them longer than they've been on therapy, and they still are doing very well. So that's encouraging, I think, because it may indicate that we don't have to continually treat patients with these agents, and may devise regimens that could be a shorter-term reaction. We're now addressing the question of some of these patients who are now just beginning to show some progression after being observed for years now, whether they can be retreated with the drug and whether they can achieve a very good response to the next go-around. I think they will be able to.
I think as we finish up, maybe Dr. Ferrajoli, you can comment us to just on the issue of tolerability and what are the side effects that we've worried about with Venetoclax and how are we addressing those?
Yes, the main concern for Venetoclax are actually very different from the one of the agent, the small molecule inhibitor we have talked before. There has to be great attention to the risk for tumor lysis syndrome. Patients need to be undergoing prophylaxis for tumor lysis syndrome. They need to be hydrated, and their laboratory values need to be monitored very closely because of the risk of life-threatening hyperkalemia related to this agent. Another toxicity that Venetoclax has is myelosuppression. We do see often myelosuppression, mostly neutropenia. It's a neutropenia that does respond to treatment with growth factor, however, is present, can be persisting, and to some extent there is also thrombocytopenia.